A nurse administers an antipsychotic to a client. For which common manageable side effect should the nurse assess the client? 1. Jaundice. 2. Melanocytosis. 3. Drooping eyelids. 4. Unintentional tremors. Unintentional tremors can be a common and manageable side effect of antipsychotic medications. This symptom is often associated with extrapyramidal side effects, which can include tremors, rigidity, bradykinesia, and other movement disorders. Jaundice and melanocytosis are not common side effects of antipsychotic medications, and drooping eyelids are less common compared to tremors. What medication should the nurse expect to administer actively reverse the overdose sedative effects of benzodiazepines? 1. Lithium. 2. Flumazenol. 3. Methadone. 4. Chlorpromazine. The nurse should expect to administer flumazenol to actively reverse the overdose sedative effects of benzodiazepines. Flumazenol is a benzodiazepine receptor antagonist and is specifically used as an antidote for benzodiazepine overdoses. A nurse is caring for a client who abruptly withdrew from barbiturate use. What should the nurse anticipate that the client may experience? 1. Ataxia. 2. Seizures. 3. Diarrhea. 4. Urticaria. A nurse should anticipate that a client who abruptly withdrew from barbiturate use may experience seizures. Withdrawal from barbiturates can be severe and potentially life-threatening, with symptoms including seizures, agitation, anxiety, tremors, and in severe cases, delirium and hallucinations. A healthcare provider prescribes haloperidol for a client. What should the nurse teach the client to avoid while taking this medication? 1. Driving at night. 2. Staying in the sun. 3. Ingesting aged cheeses. 4. Taking medications containing aspirin. While taking haloperidol, the nurse should teach the client to avoid staying in the sun. Haloperidol can make the skin more sensitive to sunlight, potentially leading to sunburn. This would be true if the client were taking MAO inhibitor. A depressed client has been prescribed a tricyclic antidepressant. How long should the nurse inform the client it will take before noticing a significant change in the depression? 1. 2 to 3 hours. 2. 12 to 16 hours. 3. 2 to 4 weeks. 4. 2 to 3 months. The nurse should inform the client that it will typically take 2 to 4 weeks before noticing a significant change in depression when taking a tricyclic antidepressant. After the medication takes effects, the nurse should close monitor for signs of suicidality. Given the risk of increased suicidality in the early stages of antidepressant treatment, the nurse should be vigilant for any signs of suicidal thoughts or behaviors and take immediate action if necessary. A client has been receiving flufenazine for several months. For which side effects should the nurse assess the client? Select all that apply. 1. Tremors. 2. Excess salivation. 3. Rambling speech. 4. Extreme drowsiness or lightheaded feeling. 5. Uncoordinated movement of extremities. Tremors, these can indicate extrapyramidal symptoms, which are common with antipsychotic medications. Extreme drowsiness or lightheaded feeling, sedation, and orthostatic hypotension are possible side effects of profenazine. Uncoordinated movement of extremities, this can be a sign of EPS or tardive dyskinesia, another potential side effect of antipsychotic medications. Neuroleptic malignant syndrome is a potentially fatal reaction to antipsychotic therapy. What signs and symptoms of this syndrome should the nurse identify? Select all that apply. 1. Jaundice. 2. Diaphoresis. 3. Hyperrigidity. 4. Hyperthermia. 5. Photosensitivity. Dopamine is a critical neurotransmitter in the brain involved in regulating movement, body temperature, and the autonomic nervous system. Diaphoresis means excessive sweating, hyperrigidity means severe muscle stiffness, and hyperthermia means elevated body temperature. A client is receiving doxepin. For which most dangerous side effect of tricyclic antidepressants should a nurse monitor the client? 1. Mydriasis. 2. Dry mouth. 3. Constipation. 4. Urinary retention. Mydriatic action causes dilated pupils, which can precipitate an acute attack of glaucoma, for although this is a side effect, it is not serious and can be resolved. A client with a history of violence is becoming increasingly agitated. Which nursing intervention will most likely increase the risk of acting out behavior? 1. Being assertive. 2. Responding early. 3. Providing choices. 4. Teaching relaxation. Once the client is agitated, trying to teach any information is not effective and may increase the client's anxiety. Teaching relaxation techniques can be done when the client calms down. 1. Being assertive shows the client that the nurse is confident in handling the situation. This may help reduce the client's anxiety. 2. Responding before agitation escalates makes interventions more likely to be successful. 3. Providing choices may help the client feel less threatened and avoids a power struggle. A family member brings a relative to the local community hospital because the relative has been acting strange. Which statements meet involuntary hospitalization criteria? Select all that apply. I cry all the time, I am so sad. 2. Since I retired, I have been so depressed. 3. I would like to end it all with sleeping pills. 4. Voices say it is okay for me to kill all prostitutes. 5. My boss makes me so angry by always picking on me. One, 2. This statement does not indicate that the client plans to harm self or others. 3. This statement indicates a suicide threat. It is a direct expression of intent but without action. For the threat to harm others must be heeded, the client must be protected from self-harm as well as harming others. 5. This statement reflects the client's feelings of anger and the cause, but does not indicate a threat to self or others. A client with a diagnosis of schizophrenia is discharged from the hospital. At home, the client forgets to take the medications, is unable to function, and must be rehospitalized. What medication may be prescribed that can be administered on an outpatient basis every 2 to 3 weeks? 1. Lithium. 2. Diazepam. 3. Fluvoxamine. 4. Flufenazine. This medication can be given IM every 2 to 3 weeks medications. It allows them to live in the community for clients who are unreliable in taking oral while keeping the disorder under control. 1-lithium is a mood-stabilizing medication that is given to clients with bipolar disorder. 2-diazepam is an anti-anxiety anticonvulsant not given for schizophrenia. 3-fluvoxamine is a selective serotonin reuptake inhibitor. It is administered for depression, not schizophrenia. The client diagnosed with depression is prescribed phenelzyme, a monoamine oxidase inhibitor. Which statement by the client indicates to the nurse the medication teaching is effective? 1. I am taking the herb ginseng to help my attention span. 2. I drink extra fluids, especially coffee and iced tea. 3. I am eating 3 well-balanced meals a day. 4. At a family cookout I had chicken instead of a hot dog. Taking MAO inhibitors requires adherence to strict dietary restrictions concerning tyramine-containing foods, such as processed meat, hot dogs, bologna, and salami, yeast products, beer, and red wines. The client diagnosed with a major depressive disorder asks the nurse, why did my psychiatrist prescribe an SSRI medication rather than one of the other types of antidepressants? Which statement by the nurse would be most appropriate? 1. Probably it is the medication that your insurance will pay for. 2. You should ask your psychiatrist why the SSRI was ordered. 3. SSRIs have fewer side effects than the other classifications. 4. The SSRI medications work faster than the other medications. Three, SSRIs have the same efficacy as MAO inhibitors and tricyclics. But SSRIs are safer because they do not have the sympathomimetic effects and anticholinergic effects, dry mouth, blurred vision, urinary retention, and constipation of the MAO inhibitors and tricyclics.